It is so incredibly dishonest what some pro-abortion activists do when it comes to miscarriage, and erroneously, deceptively, manipulatively connecting abortion to miscarriage at all. And they do that by hiding behind this idea. They like to hide behind this saying that, oh, the treatment for a miscarriage is an abortion. If you've ever been treated for a miscarriage, you've had an abortion. And women who are treated for miscarriage, they have abortions. And you want to stop women from being able to receive the proper care and treatment for their miscarriage. And what a terrible person are you? That's not the case. First of all, we know that it's not the case that anyone in the US right now, especially pro-life activists who actually honor both mother and child, which I know is a foreign concept to pro-abortion activists, but there is no one in the pro-life community whose goal it is to stop mothers who've suffered miscarriages from getting the care that they need. Nobody is arguing for that. And it is true that sometimes after a miscarriage, a physician will perform a D&C, which is dilating the cervix and using a tool to scrape out the uterine lining, scrape out fetal remains that remain inside her body, tragically, after her fetus has stopped, his heart has stopped beating. That is true. But an abortion is the intentional termination of a pregnancy, the deliberate termination of a pregnancy prior to viability, not inducing delivery, not giving birth, the deliberate termination of a pregnancy. That's what abortion is. And it is true, pro-abortion activists, that sometimes a D&C is used to perform an abortion, a surgical abortion. That's true. It's a very common way of performing an abortion. However, a D&C in and of itself is not inherently an abortion. Because again, sometimes it's used as a treatment for miscarriage. It's also used sometimes to diagnose the cause of abnormal uterine bleeding, or to stop abnormal uterine bleeding, or to look for cancer, or to find causes for trouble conceiving. It's also sometimes used after a healthy, successful childbirth. But if there are things that still need to be removed from the mother who's just given birth, a D&C will sometimes be performed. A D&C is not inherently an abortion. And there is no one in the pro-life community who is attempting, again, to bar mothers who've suffered miscarriages, to bar them from the care that they need. No one in the pro-life community is trying to do that. No one in the pro-life community is trying to ban D&Cs altogether when they're used as a diagnostic tool or for actual healthcare. And healthcare does not intentionally end the innocent, genetically distinct life of a human being who is not you. That is not what healthcare is, actually. No one is trying to stop mothers who suffered miscarriages from having an abortion. And that's another thing they like to do. They like to hide behind this. They like to play this word game where a miscarriage is medically classified as a spontaneous abortion. Again, no one in the pro-life community is fighting against spontaneous abortions. It would be wonderful if mothers didn't have to go through miscarriage, the unintentional ending of her baby's life, the tragic ending of her preborn offspring's life. That would be wonderful. We can't stop that, though. You play these little semantic rhetorical games because you can't actually defend abortion on its face. You know dang well that there's no one in the pro-life community who's trying to stop mothers from having access to treatment for miscarriage, whether that be a D&C or not. No one is trying to stop that. But we are trying to stop elective abortions to the tune of almost 1 million a year in the US alone. We are actually trying to stop that, yes. There is a difference between a mother who has involuntarily suffered the tragic loss of her preborn offspring, versus a mother who intentionally goes in and needlessly destroys the life of her innocent, genetically distinct preborn offspring. There's a huge difference there. And even when it comes to the D&C, there's a huge difference there. Because in the case of a tragic miscarriage, when a D&C is used, you are pulling out remains of dead fetal tissue, which is horrific. But when we're talking about a D&C in the case of an abortion, we're talking about pulling out a little preborn human and ending his life. There's a difference there. And I just find it very telling that pro-abortion activists, again, will play this semantics rhetorical game and try to suggest that the pro-life movement doesn't actually know what an abortion is, and that the pro-life movement wants to stop mothers who've miscarried from getting the treatment that they need, and that mothers who've miscarried have actually had abortions, which is completely absurd because, again, there's a difference between tragically and voluntarily suffering a miscarriage versus intentionally seeking out the termination of your own preborn offspring's life. There's a difference between that. But you have to play these little semantic games because you can't actually defend abortion on its face, just like you have to jump straight to the very, very small instances of unwanted pregnancy from the horror that is assault. And you have to jump straight to, oh, you want 10-year-olds to carry their assailant's baby. That's what you want. You have to jump straight to these extremes. You have to jump straight to these little word games because you can't actually defend abortion on its face. Because what we are fighting against is not mothers who've already suffered enough being able to get the care that they need. And there is, in fact, no law on the books after the fall of Roe. There is no law on the books in any state that bars a mother who suffered a miscarriage from getting the care that she needs. There's no law on the books in any state that bars treatment for ectopic pregnancy. There's no law on the books in any state that requires a mother to be almost dying, bleeding out, prior to her getting the miscarriage treatment that she needs. There's no law on the book that requires that, including the Texas heartbeat law, which stipulates that a physician must ascertain first that there is no fetal heartbeat, that the fetus has tragically died, that a miscarriage has in fact occurred, before he can then go in and perform a DNC.
We could schedule it for a week or two later.
DNC stands for dilation and curettage, a surgical procedure to remove uterine tissue. It's used for both miscarriages and abortions. The law does not require there to be a medical emergency to perform a DNC if there is no cardiac activity, like in the Hamilton's case.
Because again, a DNC is not always an abortion. When a DNC is used to treat abnormal uterine bleeding, that's not an abortion. When a DNC is used to treat a woman after she's already successfully given birth, that's not an abortion. Again, you want to play these little semantic games. You want to hide behind these false accusations that everyone can see through. You go right ahead. All you're doing is showing the world that you cannot defend the act of abortion on its face. You cannot defend the act of an elective abortion. So you have to obfuscate with miscarriage, and you have to go straight to the extremes, the very small instances of unwanted pregnancy via assault. You have to go straight to those things because you cannot just argue that abortion, elective abortion in and of itself, is a good for society. And it's very obvious for the rest of us to see. Keep telling on yourselves.